mind if I ask, so what
No,
was the
go for it.
procedure that you had done on your knee? What did they actually do? Did you have that
Well,
done on your knee?
well, what's interesting is I don't if you've ever been to Thailand or a third world country, if you want to say it that way, you'll learn quickly that the hygiene and the sanitary conditions are different than what I'm used to. I'm from Atlanta, which actually is a very clean city compared to say Bangkok. And for me, when I was there, I never felt. I thought, you know what? If I do this here, what happens if something goes wrong? I'm so far from home. Secondly, I'll never come back here. I'm not going to fly all the way back to say, hey, can you do a checkup? You know, that doesn't make any sense. So I decided to look for someone that can do this type of procedure in the States. When I looked, I couldn't find initially, but I didn't know what to look for. Then I found something where they used the placental tissue, like from somebody else, and they basically brought it into the office and my nurse injected it into my knee. So at least I was home when I did it. So I learned about it all, and I went to the clinics and I talked to the doctors, and they were really nice. I was just like not feeling safe. So I came home, and then
Sure.
I got the placental tissue. They injected my knee, and that was all it needed. And I was like, holy crap, this worked. I was literally very skeptical, but once it worked for me, I was like all on board. I said, we're changing this entire practice to be only regenerative medicine,
Wow.
which my partner at the time was not excited about like I was, because he didn't have the same experience. So we changed from rehab to just stem cell regenerative therapy, and we became the largest center in Atlanta for
Wow.
quite some time. And yeah, we did that, and it was amazing. But there's been advances in stem cells even since then that are still available. Some procedures are not. Now, I'll give you an example. If we take a stem cell, like I said earlier, you can take a stem cell and you can expand it into a colony. That's called growing or expanding stem cells. And that's how you get a massive amount of those. And you can do that in other countries. However, the FDA does not allow that to be done, use of expanded stem cells. So, that's a problem, because those are the most powerful ones. I mean, if you have a massive, like 200 million stem cells, that can make a huge difference compared to, say, a couple thousand. You see what I mean? Because if I pull out bone marrow and I take your stem cells, let's say you got 20,000. Well, if I compare that to 200 million, you could see quite a difference. So in like other countries, they can expand it, and you can get those massive quantities, and that's how they're using it for all these amazing, autism and other, incurable conditions, and and having amazing results. But it's restricted here in the United States. So the FDA says you can't take your own stem cells and put them back into your body and expand them, which is it's a problem, but I understand why, because something could go bad. I mean, it's like like CRISPR, for example. People are doing CRISPR at home, editing their own genes. Probably not a good idea if you don't know what you're doing.
Right.
So, the evolution of stem cell is what we learned about how they work. Because when I was doing it, we thought we would just inject a stem cell, or some placental tissue which contains stem cells into your knee, and then suddenly that knee would those stem cells, or that tissue would grow into a new knee. That's what we thought, but we found out that's not how it works. What happens is the stem cells go into the area, and they stimulate your own what's called progenitor cells, which are stem cells, but they're tissue specific. So you have progenitor cells of cartilage and your muscle, ligaments, those type of things, but they're only going to make one tissue line. So we found out that the stem cells, when injected, stimulate your progenitor cells to get to work, and then they start to do the regeneration of the cartilage, the ligaments, the muscle, the bone. All that's done by your own body cells. So when you get when you get to a certain age, it doesn't work so well. But obviously the younger you are, the better the results can be. So that's how stem cells work. But but what's more interesting is when they go to the area, they send out these chemical messages, kind of like text messages. Okay, think of it like that. So you get them, they send out the messages to the worker cells. Let's just say it that way. And those chemical messages are a little bubble that protects the message because it has RNA, which we're using right now in our vaccine. It's using the same thing. We're using what's called an exosome, which is the vesicle that it's protected in. So it's a circular vesicle. It has messenger RNA, which is for proteins. It has
So just so
micro.
people understand, so just say a vesicle, just explain what a vesicle is itself.
It's just like a bubble. Just
The
think of it
bubble,
like a
exactly.
bubble. Yeah,
Right,
it's a protective bubble that has
right,
contents in it. Okay,
right,
and
right.
it contains messenger RNA, which is used that's the recipe for proteins. It has microRNA, which affects the genes. It can alter the gene expression and turn off production, and it also has protein in it. And so this stem cell sends out a message to the other cell to start working, and it uses these little bubbles. Well, what they found out, like, I don't know, maybe about 8 or 9 years ago, that you don't even need the stem cell anymore. You could take the stem cell in a lab, expand them in a lab, which you're allowed to do, and just use those little bubbles.
Huh.
They're called exosomes, and just use that for the therapy. And they're tiny, tiny, tiny. They're 100th the size of a cell. So they don't have any markers that would cause the body to reject them. And they don't get seen because they don't have those markers that a cell has. So you can just use the stem cell signals, the stem cell chemicals, which is called exosomes in this case, or micro nanoparticles, and just use those for your therapy and not even have a live cell from somebody else in your body. And
And are
that's the stem cell 2.0 I'm talking about. That's where that's what they're using for. They actually took the same technology that I've been using for years for regeneration and anti-aging, and they did it with the vaccine. That's what the vaccine is. The vaccine is basically where they've taken a messenger RNA, which has a recipe in it. They inject it into the body and it goes into the cells. The cells make what's called a spike protein, which causes an immune reaction. So, and then the immune reaction causes the immune system to remember that and make antibodies, and then it's supposed to protect us from the COVID, right? So that is called exosome therapy from people in regenerative medicine. But instead of making a spike protein, we're using it to make proteins that we want, not like something that sets off our immune system.
Tom, you wanted to ask something, or?
yeah, I was gonna say, are there lesser restrictions on those as opposed to the stem cells?
You know, it's a gray area, honestly. So the FDA is only allowed the use of that to be cosmetically, but there are many doctors that do it off label, and they're getting amazing results. But it is still considered scientific, or what is it, experimental, and definitely off label. So but there's lots of doctors who do these type of procedures, but it is promoted as a cosmetic, which it does amazing results for skin. I have to show you an example of a gentleman, African American man, who got burned. His face got burned with at a barbecue fire. He was putting out a gas fire with water, and it just burned his face. And then they started using exosomes, and it was like he had a baby soft skin after 2 months, and he had no scarring and no keloids. It was unbelievable what happened. I'll pull it up on my backdrop here, and I'll show you what I mean, because it's
Yeah,
it's
that would
it's
be
something crazy.
incredible. Yeah, wow. Mark, you look like you're poised to ask something.
that I'm fascinated by this discussion.
Yeah.
How are they, I guess, harvested or created, or where do you access these
There
stem
you go.
cells?
Here,
What?
There he is. Wow.
you can see this is when he got burned. That
Oh.
is a second-degree burn, if you don't know. This one right here is like 7 days. Yeah, day 7. And this is This is 2 months later. Look at his
So,
skin.
so I just want to describe this to our WATD listeners. So what Dr. Ross is showing us is, I want you to just imagine a man whose face has been really disfigured due to burns. And then these exos, the
Exosomes. Yeah.
exosomes have literally restored him. So you would think that the before and after pictures have been reversed. That this
Yeah.
is the before with him with his great skin, and then the after is his burnt, but it's not. It's fascinating. Wow.
You know, and what's funny is he actually looks better now than before he got burned.
Yeah.
He literally got what we would call a chemical peel, because he's got a brand new a glow. Since this comes from, pregnancy, you know how women get that glow? Well, that's what he has there, kind of like as if he was pregnant, he has a glow to him. That's how it looks. And that's a real thing. So
Wow.
that's how it works.
Stretch the kindness, rush with madness. Is it sadness or just a show that